Okay, well, we've moved back into the studio from the exciting road running past the M.I.U. that was, the M.I.C. that it now is. So generally I think it'll be known as Mike, won't it? Sort of around town at some point into the future. I just wanted to raise with you a few concerns. At the previous meeting of the CCG, there was a number of comments made with regards to the paper that had been presented to the board by the officers working on the overall scheme of how they were going to reconfigure the M.I.U. The paragraph I wanted to share with you was this one, that says there was much concern within the town from members of the public and clinicians that the pursuance of the specific access conditions which appeared to have no care or clinical logic and which it was felt would cause delay, frustration and potential confusion for patients at a time when they would be under stress. I think that's still the condition that we actually have, because what was suggested would be sort of a booking either via your GP or 111 depending on time of day and whether you have a GP and all the other bits and bobs. That's really what it comes down to. And when we look at the meeting which discussed the Felixstowe Minor Injury Unit reprovision and frailty offer follow-up, which was agenda number 9 on the Ipswich and East Suffolk Clinical Commissioning Group's board meeting, it basically said quite a lot of things, but what it did say was they needed to be using a sort of a health directory which should be pointing or helping the staff that was dealing with the public as to which was the most appropriate service for you to go to. And I suppose if in your own mind you've already made that decision by either going to A&E at Ipswich if it was very serious, or possibly if less, to what was our M.I.U. here in Felixstowe, that situation of the event isn't going to change, is it? Now, what we do have by the good officers of the Felixstowe Flyer is a significant amount of information in their magazine this month, which should be coming through your door relatively soon. What it does say is new opening hours and a change in access arrangements will come into force at Felixstowe Community Hospital Minor Injuries Unit from next week. Well, that's a bit odd really. Wouldn't it be better if they said from the 1st of April, and then, because this could be picked up, what, in 3 months' time, and people could still be waiting for it to come into use. But what I found surprising, but perhaps not, is it doesn't tell you what services are actually within the M.I.U. I'd have thought that would have been a golden opportunity for this to have said that. What it does talk about, nearly half of the whole thing, is the frailty service. That is the sort of the sweetener, I think, on being able to continue using the M.I.U. Now, I don't know whether you know what a frailty clinic is or service, but fundamentally it's a system whereby frail folk, young or old, presenting, can actually have an MOT effectively that probably could avoid them having to be admitted into a general hospital. And if it's done in the community, then the service supports can also be brought into line to support that person where they're living. So I certainly welcome a frailty clinic. It's when it might be coming, and they were indicating at the board meeting it may well be at the end of the year, so it certainly won't be coming in on the 1st of April. So watch this space. As I said at the M.I.U., I'm still rather saddened by the loss of a very important self-selected NHS service that you yourself would choose to go to.